That later in the show. Right now, we are joined in studio by the president of the Mississippi State Medical Association, Dr. John Mitchell, joins us. There's nothing medical to talk about going on right now, is there, Doc?
Not at all, sir.
Yeah, no. So I guess we'll talk about, Pokemon or something. But no, seriously, there is a lot going on. And it is a big topic of discussion right now. How are you doing today?
I'm doing great. Just so happy to be here. Thank you for having State Medical here, and it's my pleasure to visit with you. And the state of Mississippi.
I want to start with a question. It's a big question. It's a question that you could probably do the entire rest of the show answering. What do you think the biggest challenges are for the medical community in Mississippi right now? What's first on the list that we need to address?
Well, first off, healthcare is multifaceted. We have multiple problems. And as you said, what's the top of the heap? Well, I don't know if there's a top single entity, but there's multiple top entities. One of them is the crisis that we have in hospitals. And that's not just in the rural hospitals, it's in the major hospitals as well. The governor had his announcement last week, which was a great first step, I think, in addressing some of the immediate problems with sustainability of the hospital situation. But it's only a first step. It's a great first step, but, this sustainability problem is going to be ongoing, and we're going to have second, third, and multiple steps.
No, I think you're exactly right. And pull that microphone up, if you would, just a little bit for us there. Just maybe a hair more.
Okay.
We're being persnickety. Just deal with it. But I have no problem. I want to make sure that you're heard properly. You call that a great first step, and it is. But the problems are not quite that easy to fix. We would love it if all it took was just throwing a bunch of money everywhere, but there's a little more to it than that, isn't there?
Oh, definitely. And the hospital situation is only part of the health care crisis. I mean, accessibility, payment reform. There's just so many complex issues in health care to address that, like I said, this is just majorly a first step. I mean, we got to get them out of the crisis stage, but then we've got to actually focus on long-term sustainability. And that may take some, reforming of the structure. Health care is such a vital part of the state's economy. Both locally, it's usually the major financial institution in some communities. So you can't get factories there. You can't maximize your education. It is a critical component both in our health and wellness as well as our economic future.
Well, and that's why it's so important to address it and to deal with it, because you use the word crisis. And that word sometimes gets thrown around and misused. It's not being misused in this instant. We have, true or false, we have some hospitals that could close within a year or two if something doesn't happen.
We have some that could close within a month or two if something doesn't happen. And yes, for sure, within a year or two, because they don't have the reserves or resources or the income coming in to replace those reserves.
And that could mean, because Mississippi is a rural state, there is no such thing as a short trip in Mississippi. If you go into the grocery store, for some folks, that's a 20, 30-minute drive one way. Same thing for healthcare or a hospital. You could take it from the nearest, healthcare, a hospital-level healthcare for someone being 20 minutes away to being 2 hours away, and that could mean the difference between life or death, couldn't it?
You're correct. And that goes back to our physician workforce as well. I mean, they need hospitals. Our patient needs hospitals. We need upper-level care in those areas. And, travel, you talk about distance. Some of them don't even have the vehicles to travel that distance if there was able to do that. So transportation issues are huge. We've talked about telemedicine and addressing that, but we have issues there in the sense of broadband. We can't carry it where there's not broadband. And so we have issues there that are being addressed, I think, with some of the ARPA funds, but we still have a long ways to go.
And we have to keep talking about this. We have to keep pushing forward with it because, like you said, I believe you just said this a second ago, that we have some hospitals in a month or two could be shut down, could close if something doesn't happen.
That's my understanding based off of what I know about some of the Delta hospitals. You know, we're talking month to month, not next year or 2 years.
And what can be done to prevent that? If we've got a hospital that in 2 months' time will be closed unless something is done, what can be done in the next 2 months?
Well, we have some great minds in Mississippi. I think that some thinking out of the box, some innovation, as you said when you opened the talk, throwing more money at things are not always the answer. So we've got to get back to the table about how can we redefine the healthcare in those regions? How can we, address the immediate needs, the long-term needs, and look at it from a broader scope than just what the crisis or Band-Aid is today.
One topic that has come up quite a bit around the country, and I just want to get your impression on it, Dr. John Mitchell, who is the president of the Mississippi State Medical Association, and you kind of obliquely touched on this with something you were saying a second ago. So again, I'm blaming you. It's your fault I'm bringing this up. Hospital billing. If anything else that we went and paid money for did billing in the same way that the medical industry bills, it would be a riot before it was over with. Is there any way that can be simplified and made a little clearer for people so they understand how this works?
Well, first off, I've experienced it. I've been a receiver of that particular frustration, I guess you would say. And working with the hospitals across the state, as I have, I see that the difficulty, some of it starts at the insurance company level. Some of it is in-house mechanics or electronics, checks and balances. I don't know if there's a single answer to solving that issue because it's such a time delay service, evaluation, insurance acceptance or denial back, and it's complicated. And I don't think that any one of us has an answer. But as I said earlier, I think that there are minds in the state that can sit down at that table and we can look at ways to make that happen. It's just executing those plans is the issue.
Well, and I think the key is always in all of these issues, whether it be in the medical profession or any other profession that we have, or organization or business that's having difficulties, step one is to sit down and have those conversations and not just keep trying to kick it under the rug and pretend that the lump isn't there.
Correct.
And we don't have the best history in that department. Let's just be honest here.
Well, probably not. As I said, you can tell by my gray hair, I've been at this a long time and have experienced it both at the clinic level as well as the hospital level as a consumer level. And it is really frustrating. But like I said, I think the complexity of it is if you go in and you buy some part at the parts store, it goes on your bill, it goes out. There's no third party, no multiple parties to say, where is that appropriate? Did you use it? Did you not use it? Could you get it? And in healthcare, we always have all of these overseers to complicate the issue in the billing process. And I think as we work for more uniformity in insurance coverage, prior authorizations, ultimately we've got to come to a point where we can streamline or know front end, is this going to be accepted or not, and therefore we can get the bill out in a hurry.
There are some things. There are some unique opportunities that healthcare provides. Perfect example, going back to the hospitals and the billing. I don't know of anywhere else where you can go and buy $100 Tylenol, which is kind of a running joke that some people make, but the billing gets complicated. But at the end of the day, the hospital has to bare minimum bring in as much money as it's costing them to provide the service. Otherwise, we wind up in the situation you're talking about. and we have to fix that. We're coming up on a break. Can you stick around?
Yes, sir.
I haven't run him off yet. I'm not sure how that happened. We've got Dr. John Mitchell, president of the Mississippi State Medical Association. We'll continue the conversation with him on Middays, live in the Element Wealth Studios. Dave Hughes here in studio with us. Dr. John Mitchell, the president of the Mississippi State Medical Association. We were talking before we came on the air. You picked a whale of a year, decide to go for this office there, Doc.
Yeah, that was one of those in retrospect. Last year would have been a much easier year for me.
It would have been quieter, definitely, because while this problem is, in the public eye and everybody's talking about it, this problem didn't just happen in the last month or two. This has been building. This has been coming for a while, hasn't it?
Yes, and I'll have to reflect a little bit on your previous conversation with representative guest in the sense of why do we wait to the end on any of these type things? And I think in healthcare, and especially in Mississippi, we've kicked the can down the road for a number of times till we get to this point of crisis, and then now we have to immediately fix it when I would wish that we could look forward to the future and have strategic plans. And we've done that somewhat with our workforce development and physicians in the sense that we have developed a very workable plan, and we're making some impact on both maldistribution of primary care and increased physician workforce across the state. So healthcare is one of those that we've seen some of this coming for a long time. But, I hate to go back to the year of COVID, but COVID personified and emphasized, I think, some of the disparities and other issues in healthcare, and has had a lingering effect, I think, on the financial crisis as well.
Well, and I would think, and correct me if I'm wrong, I'm looking at it from the outside in, I would think also COVID and with the various federal dollars that were just spewing forth like a fire hose out of Washington probably kind of masked some of the problems a little bit and made it a little harder to see, I would think.
Yeah, they were very welcome at the time because that was another one of those financial crises. So, you got to take the bad with the good. But the good side was it kept us going. But, yes, it did mask some of the things. And plus, I think it's really now we're seeing it more in the workforce in cost of payroll and personnel and whatnot, that some of that is lingering over, as well as I have private businesses and other things, personnel costs are really exorbitant now in both in healthcare and in private sector. So, that's a leftover from the COVID era that was, it was necessary at the time, but at the time now how we address it's a different issue.
And that's the thing that I think gets lost in the shuffle sometimes because we keep drilling down into individual areas, but you hit the nail on the head. The current labor market situation is across the board.
Yes.
Because as I say, and I understand this, and I think a lot of people do, over the last couple of years, if you haven't received a bump in pay, you got a pay cut because things cost so much more.
Correct.
So that is driving a lot of businesses to have to cut into their bottom line, and some businesses it's driving out of business, which is what we're trying to avoid with the hospitals.
Correct.
Now, Governor Reeves, in his announcement last week, there is a word in actually the headline of the press release that I want to focus on. The headline is, Governor Reeves announces sweeping Medicaid reimbursement reforms generating an estimated $700 million for hospitals. Let's focus on that word estimated for a second, that just kind of is sitting there like a landmine a little bit, because $700 million, it could be more, it could be less.
Yeah, projections are what they say they are. Projections, estimates, guesstimates, whatever we have as far as the best available data we have today. But as we already know, things can change tomorrow, next year, whatnot. So we're looking toward this as projections, and I know that individual units, hospitals, administrators are a little bit, as the old saying says, I hold my breath until it comes. So they are anticipating, but they can't spend it till they get it. And so I think the projections are good. They've done the best they can, but time will tell us how good or bad those projections are.
And the other thing to remember about this is not just a one-time thing. This is going to be an ongoing increase in the amount of Medicaid money that the hospitals get, right?
Correct, because Mississippi is advantaged because they're disadvantaged in the sense of their federal ratio. And I don't see that changing dramatically, although it could. So as long as we can, spend 23 cents, I think it is, we get 77. So for every dollar, it's 77 cents of that is federal money. That's not going to change. So, as we go forward, this is a sustainable process as long as the feds keep their end. But we've talked about the feds and potential of September 30th and spending bills and whatnot. So that's an unpredictability too. So all this is projected off of known facts today as they are today.
And the one thing, when you come out with something like this and you make an announcement like this, an estimated 700 million, that is not the best possible case scenario, and it's not the worst possible case scenario. They try to put it somewhere in the middle to be realistic. But it could be more, could be a lot less. Which is why, as you said, you can't really plan your budget around it because you're not 100% sure what you're going to get.
Correct. And you made an assumption, and we live off of assumptions, that they hit the middle. I don't know that they hit the middle. I don't know if this is the upper limit of their projections or if it's the middle of their projections. If you ask me how many people attended church Sunday, my upper limit, I estimate high as opposed to low. I don't know off the hand whether or not these projections are middle ground or upper. If I were making headlines, I think I would choose upper limit. But at any rate, any administrator is going to take time to assemble the data and put together what their best guess is, as opposed to what the pie in the sky is.
We're 3 months away, a little over 3 months away from the legislature being back in session. If you found that genie lamp and got to rub it and got to wish and get one thing through the state legislature this year to help the medical system in Mississippi, what would it be?
Now, you're getting back to more of a personal question now, and this is from John Mitchell, not necessarily MSMA. I don't know that we have our number one defined yet, so I'm not speaking for the organization as much, but I'd like to see, as I think is across the state, and if we polled our membership, increase or access to care. Call it what you want. Make it any way you want to. Use what are tools that are possible. But I think that we have a class of working class individuals that are working their tails off, but still can't make ends meet. And healthcare is important to them as it is to any of the others. And they're caught in between. They're not in poverty, so to speak. They're not in companies that can afford the healthcare supplements or payments and whatnot. That working class individual would be what I would like to see addressed.
And this goes back to something that Rhino and I were talking about at the beginning of the show. It was the old James Carville quote from when he was running Bill Clinton's campaign, "It's the economy, stupid." We need to focus on what's being talked about and worried about around the kitchen tables in the Delta and Oklahoma and Kansas and everywhere else. That's what needs to be focused on.
Great.
Is that a fair statement, do you think?
It's a fair statement.
But we'll have to wait and see how things play out because there's a lot of factors that are involved in this.
As we've already said, we know we're going to have a new Speaker of the House. We can presume who that's going to be, but we don't know that for a fact. We saw that play out at the national level. But we have good presumptions, and they've already, admitted that we're going to have these discussions, and the Senate's the same way. So I think that, again, I think the opportunities are there. As I said, the road is going to be bumpy, and maybe I should have chosen a different year. But at the same time, it's a great opportunity, and I think that we'll have some great discussions. And I will commend that MSMA would be happy to be at that table to discuss that options for the future.
Well, let me just say this. If you were excited that you had to deal with this mess, I'm not sure I would want you in that seat, Doc.
I wouldn't say I was excited.
Yeah, that's what I'm saying.
There's only two ways that you can address issues. You look at them as either difficulties, obstacles, or opportunities. If we just say they're opportunities and move on, let's leave it at that.
And then if we have to, put our fingers in our ears and hum real loudly so we don't hear anything else. Sometimes that's what it takes to get things done, guys. Dr. John Mitchell, president of the Mississippi Medical Association. Enjoyed having you in here, man.
Great. Look forward to the year. I may come back.
Yeah, but come on back anytime. We'll if nothing else, give you a place to hide for a few minutes. You know, that might come invaluable later this year. Don't discount it. We continue on Middays in the Element Wealth Studios next.